I think some of the biggest challenges facing academic medical centers today are healthcare reform, the cost reductions at the National Institutes of Health, Medicare reductions, and the impact of that on the decrease of costs in our hospitals, the decrease in reimbursement for residencies, and the competition that we're facing from external environments like the local consolidation of hospitals, as well as the local consolidation of physician groups. So there's a lot of pressure on us. Well, academic medical centers are taking on a lot of new approaches, and we have to be increasingly more nimble and increasingly more flexible. So some of the approaches that we are taking is a recognition that we have to go from a fee-for-service environment to a population management environment, and that is very important. So we are embracing the patient-centered medical home. We are embracing the accountable care organization, and these are methods that we're doing really well with. There are other things that we're doing a little bit less well with. So we have a very heavy bureaucracy, for example, and we need to think about how we can become less bureaucratic and much more nimble. And I think that will make a huge difference when we can do that. We could also streamline our educational process. A lot of academic medical centers today are thinking about whether or not we should shorten the educational course of medical school, maybe from 4 years down to 3 years, for example. We have to think about ways that we can actually make decision-making, the decision process within academic medical centers, much more streamlined and easier and faster. That would make a huge difference if we could do that. It would be great, for example, if we could come up with more ways to get research funding within our health systems. That would be fantastic as well. So there are a lot of things that we could be doing, but right now I have to say that we're simply not flexible enough.